Yeah, I remember we used to get calls dispatched to go search for Alzheimer's patients. That's always people wandering around. Then you find them and you ask them what they're doing, and they were going somewhere, and they know it's just right around the corner, but they're not quite sure what corner they're going around. And you always say to yourself, you know, better them than me. Or moreover, you sit there and wonder, says, you know, I'm glad I don't have to deal with that. And lo and behold, 5, 6, 10 years down the road, there you are right in the middle of it. Dad, come on. Your blood sugar's at 51. It's 225. You've been sleeping all day since 6 o'clock yesterday. You need to get up and eat, take your medicine, do what you're supposed to do. It's not,
Okay.
I know it's not healthy for you to be here in bed like this.
All right.
Dealing with two elderly parents makes me wonder just how women do it with raising kids. I mean, constantly picking up, worrying about them. You got this, do you have that? Don't do this, don't do that. But I guess with kids, they're growing up, so they're learning. With old folks like this, is they've already been set into a pattern, but then they can't remember their pattern, or what they do remember has nothing to do with what they're doing now. And their life is like an instant replay, or a tape going in a cycle over and over and over again. And it's absolute lunacy. To them it's normal. I'm the one who's losing my mind. Come on, Dad.
All right.
That's what you've been saying, all right, all day long. You just roll over and go back to sleep. This has gone on too long. This is what you've done for 2 years, Dad. You need to get up, you need to move. It's not healthy for you. It's not good for Mom, and it's not good for me. Because all we do is worry about you and take care of you, and you do nothing. Now, will you please get up and do something for yourself? You have difficult days, you have good days, and you have days you wish you were never alive. It's kind of difficult watching your parents grow old and not being able to do what they did.
Did you hear it, Papa? Did you hear what he said?
Yeah,
What did he say?
it's not good for me.
Mm-hmm. And what else? What else did he say?
Need to get up and take care of myself.
The what?
Need to get up and take care of myself.
Yes. Come on, Papa. Just get up and go get wash and eat a good meal. Come on, let's go.
So, but you just do the daily things for him. Let Mom do as much as she wants, because if you don't, she gets upset because she thinks she does everything. And I let her think that. And she wants to be self-sufficient. She knows she has difficulties. She doesn't understand the concept of it, or
the only things I can take is call an ambulance and take him to the hospital. Because I can't pick him up out there. There's no way I can pick him up.
is Lloyd there?
Yes, Lloyd is here.
Huh?
Lloyd is here. He's here and wait for you to ask him. But you think you are too good to ask for help. But you're the one that need it, Papa. I can't help you anymore. I just can't. Let him help you. You need to be helped, Papa. He's your son. He's not an stranger. That's why he's here, Lloyd, because we all really try to help us. Why can you say, Lloyd, give me a hand? Pick me up. Ask me to bed. If that is too much for you, he's not a stranger, he's your son.
As a paramedic, senior firefighter, paramedic, I spent more time on an ambulance than I did putting out fires. And those proved to be interesting, but you always get these classic calls. 2 or 3 o'clock in the morning, you find some elderly person wedged between the toilet seat and the wall or the sink, and they've gone into cardiac arrest, and it's usually as a result of when they bear down to have a bowel movement, it causes their heart to slow down to the point that they just pass out, go to cardiac arrest. And that's always a thrill when you, your partner, and another engine crew's there in the confines of a 4x5 room trying to get to this person and start CPR. It's when you're going through the motions, it's interesting, but afterwards you sit down and kind of you have to chuckle at it. Is that Dad? How you doing, Dad? Huh?
Open the door, huh?
No way, Dad. Hold my breath. Hold on.
Huh?
Gee, would you die in here? Jeez, Dad. What do you need? Need some help?
No, I'm just going to get him and put my pants on. Let's put them on now.
Did you wash up, Dad?
Huh?
Did you wash up?
Yeah, why?
I was just looking at the toilet seat. It looked like you.
Toilet seat, what?
It's stained.
Yeah, I saw that stain on
Huh?
It's real bad.
Careful now. You squeeze up on those, you're breaking it.
Yeah, I'm bringing it. Hold on, boy.
Yeah, all right. Go that way because it won't fit through there. There you go. There you go, Dad. Hey, the joys of parenting.
Huh?
I said the joys of parenting.
Yeah.
I guess most of my memories of my parents were growing up as a child, and they were young, active, and we did a lot of things together. Now it's them doing absolutely nothing because they're afraid to leave the house. They're glued to the house.
What are we doing today? I don't have to finish either. What are we doing today?
What do you want to do?
Hmm?
What would you like to do? Sleep, watch TV, go somewhere.
I go fishing.
Go fishing. Where do you want to go fishing at? Go to Florida, go fishing down there.
Mm-hmm.
You want to go to Florida, spend a couple days down there? Maybe for Christmas, we go down and visit John. It really gets my goat about all of it is I've got two brothers who it's like, that's your problem. You're the oldest, you deal with it. And it's like, you know, and I understand they all have their families, they've got their own lives. And I'm fortunate enough to where I can do this, you know. But I would wish they would just make a call once a week. They won't remember that they called or anything, but it's just the fact that they do call and say, hey, we think about you, we love you, we hope everything's going okay. But they don't even do that. And that's the sad part. It's like I don't remember. Would you like to do something like that?
Not such a bad idea.
Okay, Dad. So, would you like to do that?
Hmm?
Would you like to do that?
Do what? Go to Florida?
Yeah, go to Florida. To go fishing. Visit John for a couple days. Because I need to know these things, because when your appointments come up, I have to schedule everything around your appointments. We could fly down and rent a car, I can drive from here. If we drive, it'll take us about 2.5, 3 days. But that's a lot of time to be in the car.
Mm-hmm.
Okay, I need some answers on this.
On what?
On if you want to go fishing in Florida. Because it's a nice time of year to be down there. They get you out of here for a week or so. Let's get you down. Okay.
Okay, what?
So you want me to set up a trip for Florida?
No.
No.
Who wants to go to Florida?
You just said you wanted to go fishing in Florida. You know, what can I say? What can I tell you about this? What gets me through all this? Well, I got a dog who makes me laugh. I've got some really good friends who give me a place to escape to. I've got a wonderful fiance who stays in touch with me every day. And she knows what's going on, and she's ready to dive right in the middle of it. But as hard as it gets, I have no regrets. And it does get hard.